Hi everyone, my name is Daisy Garcia and I'm going to be presenting on HIV among African American women. So, an introduction to the health topic, African American women are disproportionately affected by HIV and experience several challenges due to existing health and racial disparities. Black women account for the largest share of new HIV diagnoses, with 14 times the rate among white women. Black women are also more than 14 times as likely to experience death from HIV infection as white women. The Black population is more susceptible and at risk of disease, illness, and mortality than any other racial group. African American women experience racism and discrimination in the health system, which has also caused a mistrust in the medical system. HIV in the United States. Although Black Americans represent more than 12% of people residing in the US, they account for a greater number of HIV diagnoses, approximately 42%, and people living with HIV infection, approximately 40%. African Americans are 8 times more likely to be diagnosed with HIV in comparison to the white population. Black females have 15 times the rate of AIDS as compared to white females. Although HIV infections remain the same among Black women in 2019, the rate of new infections was about 11 times higher than white women. In 2019, the CDC revealed that an estimated 1.1 million people residing in the US had acquired HIV. Out of every 100 people living with HIV, only 87 knew their HIV status. HIV in California. In 2019, there were approximately 4,000 new HIV diagnoses in the state of California, with infections accounting for more than 15% of women. According to the California Department of Public Health, 1 in 7 new HIV diagnoses are among women and are accounted for as sexual contact. The number of people living with HIV infection increased to over 137 in California. In 2019, the prevalence rate of diagnosed HIV infection was approximately 345 per 100,000 population. Of the 137 people living with HIV in 2019, 75% were in HIV care and more than 65% achieved viral suppression. Black women account for the largest share of new HIV diagnoses, with more than 14 times the rate of white women, while Black women also are represented with about 26% of new HIV diagnoses as of 2018. HIV in LA County. There are more than 58,000 people living with HIV in Los Angeles County. According to the HIV surveillance report of LA County, HIV diagnosis rates decreased by almost 50% among African American women, although the infection rates for Black females remained the highest. In 2019, the Black population had the lowest connection to engagement with programs, retention of care, and viral suppression. Overall, there has not been sufficient improvement in terms of long-term HIV care among Black women. In 2018, females were ranked the highest at 36% among groups with greater likelihood of not obtaining HIV care within 30 days of diagnosis. In 2020, the World Health Organization reported that more than 1.5 million people were newly infected with HIV. Nearly 700,000 individuals died from HIV-related causes during the year of 2020. Also in 2020, there was about 5,100 AIDS HIV-related deaths in the US. In 2019, the mortality number for people diagnosed with HIV infection in California increased for more over 1,910. Although the rate of survival after 5 years of HIV diagnosis is greater than 90%, Black women are more likely to experience death quicker than men in LA County. Approximately 90% of incident HIV infections among Black women in 2016 could have been avoided if the incident rate for Black women were the same as the rate of white women. The top 3 leading causes of death among Black women are heart disease, cancer, and stroke. The top 3 health issues with high incidence rates is diabetes, maternal mortality, and asthma. Determinants of health and risk factors. Determinants of health and risk factors, such as behavior, play a major role in the transmission of HIV and type of behavior exposure. According to the CDC, approximately 7% of Black or African American people with HIV had sex without using HIV protection. Injection behaviors also place people at an increased risk of HIV and other diseases from sharing needles. Social determinants of health are the conditions in the environment for which people live, work, and interact with one another. The built environment also plays a crucial role and directly impacts the ways in which groups of people grow the most vulnerable to health issues such as illness and disease. The social determinants of health can be seen as a pathway to HIV infection. Other factors that are also play a major role include the level of education, multiple sex partners, substance abuse, exchange of sex for goods or services, poverty, and also race and ethnicity. These directly influence the risk of disease, health outcomes, and quality of care. Traditional views of health. So, intersectionality plays a major role here. Black women living with HIV in the United States are less likely to use antiviral therapy or ART to be virally suppressed, and they're more likely to experience mortality from HIV related causes than any other racial group. Health disparities can be attributed to systemic barriers that are associated with marginalized identities, such as people who identify as Black, a woman, or a person living with HIV. Socioeconomic status, systemic oppression, and stigma also play a major role in the quality of care that Black women receive. Black women need to have increased access to competent healthcare that recognizes differential access to a multitude of social, political, and economic opportunities. Perceived barriers in the access and utilization of treatment and care services consist of limited economic ability, such as trouble with childcare, housing, and transportation. With these barriers in place, receiving treatment and continued care for HIV can be difficult. Lack of social and economic power can influence the ways in which women navigate power, such as in sexual relationships, and how they utilize the use of protective resources. Racism and sexism can also contribute to the racial and gender disparities regarding HIV prevention and treatment. The stigma behind gender roles and prescribed norms, for example, can be seen when women tend to silence their own thoughts and feelings to make sacrifices for others. Stigma can create barriers to getting tested on time and engaging with long-term HIV care. Recommendations. There is a need for improvement among public health messages and how they are conveyed and reached by these priority populations. Research findings based on course material and evidence-based practices or model programs are necessary in formulating public health strategies. One recommended strategy for a public health professional is the utilization of faith-based organizations. For example, public health professionals should develop trust within the community by collaborating and communicating with community health workers to create programs for partnership and leadership. Faith and spirituality play a significant role in this community because they are more likely to go to church and participate in church-related activities. Another strategy would be to be culturally aware to the lack of trust in the system. The incorporation of salons and barbershops as an outlet for health awareness and health education is a unique way to involve and engage the community. The Business Response to AIDS is a program that is evidence-based in partnership with the CDC to support HIV awareness. They are also partnered with Cuts for Life, which they host educational events while giving haircuts. The Black AIDS Institute, or the BAI, is an organization dedicated to ending the HIV/AIDS epidemic among the Black community. So this organization offers a certificate program that provides participants with a curriculum, assessments, and accessibility to prevention and treatment. Future directions. Collaboration from the Department of Public Health, Division of HIV and STD programs, and the LA County HIV/AIDS strategy has resulted in a 5-year initiative to end the HIV epidemic. So within this 5-year initiative, this is a plan for the United States to focus on early diagnosis, timely treatment, and prevention of transmission, and also rapid response. Financial support from stakeholders is necessary to provide affordable, at low cost HIV healthcare and resources such as the Ryan White HIV/AIDS program. The engagement of community members for building trust and relationships among minority groups living with HIV is very important. Healthcare provider training and education resources on the health topic of HIV treatment and prevention is made available through services such as the Health Services and Administration. Investments from health agencies and cities, public health departments also contribute to the improved research that is needed among these communities. In part of ending the HIV epidemic in the United States, partnerships with state and local communities can employ strategies to expand access to PrEP services. Outdated laws have shown to increase stigma and need to be further modernized as well. So, final conclusions, as African Americans continue to face the most severe burden of HIV compared to other populations, it is important that further research is conducted to explore the ways in which socioeconomic factors contribute to health gaps, high prevalence, and disparities. Data reflected from global, national, state, and local demographics support the need for patient-centered interventions and programs to understand the medical mistrust and increase in prevention and treatment. Determinants of health, risk factors, and traditional views of health are barriers to healthcare that continue to drive HIV stigma and disparities. In striving towards bridging the gap between health disparities among the Black population, especially among women, it is essential that further research and data is collected on the multitude of health indicators that play a significant role in HIV transmission, prevention, and treatment. And here are my references. Thank you for listening.